So today we're going to be talking about patient safety with passing our instruments as a four-handed dentistry between our doctor and assistant. We have our doctor zone, we have our assistant zone, then we have our static zone to where maybe our instrument is placed or our countertop or a cart. And then we have what is in our safety zone, which is our transfer zone over top of the patient's chest. Ideally, it's great that if you get into a great habit, and of course for our patient safety glasses, we want to eliminate anything from penetrating into the patient's eye and keep their vision as safe as possible during instrument transfer. So today we're going to be talking about passing instruments, and also that sometimes we have to keep in realization if our doctor is wearing loops or if our EFTA is wearing loops, if you're assisting an EFTA, that those loops has your doctor focused on the patient, that when we're passing instruments in our instrument zone, ideally our doctor does not want to have to look up to see where that instrument is being passed. So as we know and need to remember that this doctor and assistant flow takes some time and some practice to where there's an understanding of where those instruments are going to be. But be patient and get in that routine of instrumentation with your procedures and passing instruments. So when your doctor has an instrument in their hand, when they have the instrument in their hand and you're working on, let's just say, a front tooth, when your doctor is going to pass an instrument or you are going to pass an instrument as an assistant, your doctor is typically going to stay just a shoulder turn from your patient. So I am going to hand this instrument over to John as the assistant, and he is going to pass it to me. And I can feel with some slight pressure that that instrument is in my hand. I don't want to question as the doctor or an EFTA on is that instrument where I need it to be placed, meaning you don't want to be too dainty with it, too light. So a little bit of pressure. So we're going to yet again four-handed dentistry, and with some pressure that now that instrument is back in my hand. So as you can see, as an assistant, John is only using his left hand, and I am staying just an elbow turn from my patient's face, yet again over top of the patient's chest. What I do not want to do, or as an assistant, be crossing over top of the patient's face. And John is only using a pinky to take that instrument to keep things flowing. As we know then with the right hand, we would be holding possibly our saliva ejector, our air water syringe. So as we know as dental assistants, that we're balancing multiple tools and devices in our hand. So this is a pretty good flow that John and I are demonstrating on what that four-handed dentistry would be. So as a person wearing loops, I would not have to look up from my patient's face because I would be confident on where that instrument is being passed from. So our patient safety, yet again with our glasses, if John turns into a different area as an assistant, so you're a little bit more towards the top of the head with the patient, we do not want to pass instruments over top of the patient's face. So this is a very large no-no. We do not want to do that because naturally we don't want to fumble or be non-confident if that instrument is in that patient's face. Along with if we are talking about the doctor doing an injection. So if your doctor is taking that syringe from the right side of the patient to give the injection, then at this point as well, whether your doctor is placing that syringe back onto the tray, coming back around the right side of the patient, we yet again are not doing this. We are not transferring a syringe to the assistant as if our needle was uncapped, that we would not be able to determine really in our depth perception where that needle would be placed and would put us at a high risk for a needle stick, which is what we are eliminating or trying to eliminate at all cost. So Yet again, our transfer zone for an instruments, your doctor should be placing the syringe back on the tray behind your patient and keeping our instrument transfer zone yet again over top of the chest. That assistant transferring that instrument with that left hand, taking that instrument from your doctor with the one-handed pinky type maneuver, and this keeps that appointment flowing for your procedure for the day. So we hope that that gives some explanation and some help of how that four-handed dentistry flow is to go, along with our patient safety with our goggles. And we thank you for your support. Continue to watch our videos that are on YouTube and TikTok. So if there's anything specifically that you need help with, please let us know, and we would love to make that video for you to help you be more confident as a dental assistant. So thank you for watching.